Well, thank you, John, and welcome to the next panel and really a day-long spotlight on understanding the frontiers of working with vital conditions. And today's panel, we're going to focus on three pioneering place-based partnerships that are organizing around vital conditions, led by three of my favorite colleagues who've taught me so much about this work. We're joined with Samantha Shack, Executive Director of the Leonard Parker Poole Institute for Health in Allentown, Pennsylvania. Rosalinda Natividad, who's the founder and CEO of Insight Networks, that talked to us about work in the Doña Ana County, New Mexico, on the border, U.S.-Mexico border, and then Liz Baxter, CEO of North Sound ACH, up there in the northwestern tip of the U.S. on the Canadian border. So we're covering a lot of geography, but more importantly, we're covering a lot of the frontiers of what it means to really focus on establishing vital conditions with community, people, and place in the foreground, with a special focus on equity and racial justice. Our colleagues will also talk about who they're doing this work with and how they're working across differences to share power, to honor everybody's expertise in doing things that none of us can do alone. And we'll talk about how do we channel resources toward those that have the most to gain? There's no shortage of opportunities to make great strides in this work, but how do we do that leaving nobody out and being able to stand in solidarity with those for whom the world has never been built for them to thrive? So we'll start in Allentown, Pennsylvania with Sam. Tell us a little bit about how you came to, what was going on with you and your work and your colleagues when you started to focus on vital conditions, and now what does that mean for you in your efforts to establish health and well-being for an entire community?
Sure. Thank you, Bobby. Happy to be here today. The Poole Institute for Health is a subsidiary of Lehigh Valley Health Network. And as Bobby shared, we're in Allentown, Pennsylvania. And when we started in 2021, our role is really to invest with communities. So thinking about a very deep place-based approach to investing in vital conditions, and also to invest in leaders as we increase our collective capacity to think about new and innovative ways to create conditions for thriving, and therefore, hopefully, improve health over time. So when we started, we really wanted to focus on how do we get upstream? How do we make sure that we are investing and using our resources in ways that creates more opportunity for people to thrive over time? And thanks to our colleagues at the Ripple Foundation and others, really have embraced the vital conditions framework as our way of thinking about that, recognizing that social determinants of health have become a term that is used interchangeably for both those things that are meeting urgent needs and those things that are longer term approaches and strategies over time. And the vital conditions framework provided us with new language and a new way to frame that, to think about what is the totality of the ways that we're investing in our communities and making sure that we're balancing both the social needs and vital conditions pieces. So Allentown, Pennsylvania is about an hour and a half outside of Philadelphia and about an hour and a half from New York City. We are an urban core of a 2-county area within Pennsylvania, and we have about 125,000 residents here in Allentown. And over the last decade, we've really seen a reinvestment in our downtown in Allentown, and have a lot of new business and economic development that has happened. And over that time, there's been a lot of conversations about what happens in the neighborhoods surrounding that downtown area. How are we making sure that they're invested in as equally as we have been in our downtown? Those neighborhoods tend to be those that have been disinvested over the years. And so really thinking about how do we make sure that the economic benefits that are coming into the city are reaching to all the different neighborhoods that are in our city. And so when the Poole Institute for Health began, we wanted to take a place-based approach. And for us, that means how do we think about a neighborhood and where the vital conditions are intersecting in one place? We know that people spend most of their time in their neighborhood and access most of their resources there. So can we decrease our geographic footprint and think about how housing and education and food access and civic belonging, sense of belonging and civic muscle all intersect in one place. And in doing so, realize that will lead to systemic changes, sustainable changes over time. And so our first neighborhood that we are partnering with in Allentown, I think there's two things I'd want to highlight about that. One, a number of years ago, we started what we call the Pool Fellowship for Health, which is a 6 to 9 month training program for nonprofit and government leaders around what are the skills needed to work in cross-sector collaboration. At the end of the day, what underlies all of this is that we all need to contribute towards the solutions to address those really complex problems we know our communities are facing. And we don't often have time or space to think about the skills that are needed to work in collaboration. Collaboration is hard. It's not the easy solution, but it is the more impactful one over time, we believe. And so how do we prepare our leaders of the future with the skills they need to not only think about their organization and their outcomes that they need to achieve, but how they contribute to something greater, something bigger, and how they might look for opportunities where coming together with other cross-sector partners could lead to different or new solutions that wouldn't be possible if they were working independently. So that has become a really core piece, that fellowship. We've grown over 100 leaders over the last 10 years. And that enables different kind of conversations than we were able to have before. There's new language for us to build on, a new sense of trust. Trust and relationship building is core to that, and making sure that there's a starting place for us to think about that cross-sector partnership, and being able to bring that piece together within the neighborhood that we're working has been really impactful. And the second thing I would want to highlight is the sense of belonging and civic muscle. That is the sort of core of the vital conditions framework. And I think the one that has been least invested in over time, and the one that without which we cannot do any of the other pieces. And so we've spent a lot of time building up our neighborhood infrastructure, thinking about the community as a system in the same way that the healthcare system or the education system or the housing system exists. And often we don't think about it that way. We think about individual people living within the community as opposed to, what is that system that they are working within? How do they connect with one another? And then be able to bring forward their voice, their desires for their community and their built environment. And so we are really working with our community organizing partners, along with many others, to have a neighborhood association, to think about how neighbors and residents are connected to one another, to get to know the individuals that are living within the neighborhoods that we work, so that when the healthcare system or any other system needs to do that outreach, that engagement, we have a container in which that can happen, and we're in more of an ongoing relationship as opposed to being more transactional. And all of that is sort of situated within a larger healthcare system that has a 7-county footprint and growing. And we have to also think about how do we do that not just in one neighborhood, but across our entire network. And the Vital Conditions Framework and Wellbeing portfolio has become a way for us to unify the different levels of intervention and partnerships that we have across the network. We are cataloging all of our community health related efforts using that Vital Conditions framework and well-being portfolio to make sure that we can think about what are the types of urgent services and partnerships around social needs that we have in each of our different communities that meet that community's need. But also, what are those investments in vital conditions? What are those longer term prevention strategies that we are thinking about? And how do we make sure those are balanced, or where there are gaps that we can identify and move forward together with that? So I think it's a really helpful framework for walking it back to how does this tie to health and healthcare? And how do we think about the wide array of services and partnerships and deep community work that we need to have, but recognizing that it's not a one size fits all, that we'll have to customize that to each of the communities that we're in. So with that, I will stop there and happy to answer any questions as we go on.
Well, thank you so much. And what I'm struck by is how many questions you asked in that summary, all the questions you're asking yourselves, all the things that are leading you to form different kinds of relationships. Your focus on health and well-being hasn't diverted, but the questions and the scope of who you're going to find those answers is changing so dramatically. So thank you. That's a really thrilling way to tell the story. Rosie, I've heard you ask some very poignant questions and ones that I'm still learning into. So please tell us your story.
Thank you so much, Bobby. And it was such a pleasure to be here today. I'm Rosie Natividad. I'm founder and CEO of Insight Network. Insight is a community company. We are headquartered here in what's called the Borderplex, so New Mexico, Texas, and Mexico. And our mission is to ensure that all diverse communities have economic mobility. And we do that through community-centered strategic planning, grants management, and grant writing. And so I wanted to share with those that are watching today, I founded the company understanding as a third-generation Mexican-American that everyone's journey to health, wealth creation, well-being, it's not always equitable. And I wanted to utilize coordinated talents across the nation to create better journeys for those communities nationally and those struggling unnecessarily. And so when I learned about the vital conditions, it was through a partnership with We in the World. They were working through health equity initiatives across the state of Illinois. And I was so inspired by the work done that I included it into the DNA of our company. So vital conditions is actually a mainstay of what we do. You're going to see more of that work come in 2025. It is a wonderful organizing framework, especially with our partners that we work with that are mostly in government. And so when it comes to how we utilize the vital conditions for health and well-being, I wanted to tell a story about my backyard. So where I come from here in Doña Ana County, New Mexico, El Paso, Texas, Ciudad Juarez, the borderland area. Doña Ana County is beautiful. If you haven't had the opportunity to come during the fall season, enjoy some hatch chili, some Stamen pecans, some of these national brands that you may see on the shelves, but you haven't had the opportunity to meet the local farmers, ranchers that grow it, we encourage you to come and see our community. It is the second largest in the state of New Mexico, bordering around 220,000 residents, and it's vast. 3,800 square miles of varying type of topography, from our beautiful Organ Mountains, again, to the rich northern areas of agricultural, to more industrial-based feel to the border as we grow our borderplex and our port of entry. And so there's so much to be seen. And at the same time, Bobby had shared, sometimes a world isn't always built for us to thrive. And so while I absolutely love our community, we are working to strategically plan and build a vision for that county where all are thriving, all are aging well, all are feeling that they belong and are civically engaged. And so similar to other communities around the nation, there was a significant community degradation from the racial legacy of interstate highway construction seen through urban planning in the 1950s. There was also a use of exploitation of certain type of development law for unincorporated settlements that was entirely built for Mexican immigrants as they were looking to make their way and achieve the American dream in the United States, creating colonias. And so there are 37 colonias in Doña Ana County. That's 25% of the state's colonias. So we do have a significant amount of people living in poverty with unpaved roads, lack of electricity, water systems, wastewater treatments, and decent housing. And so how can Doña Ana County community, the elected officials, our community residents, our state, how can they move past these systems that they've inherited and policies that were inadvertently or advertently racist? How do we move past that and build beyond and think of a world where we are all thriving? So here enter the vital conditions. And so with the vital conditions, we did integrate that into the strategic planning process. We are creating what's called vital condition teams. And we are modeling that after the federal plan for equitable long-term recovery and resilience that we saw put together through the Rethink Health Initiative and partners. And we're creating multi-solving environments where departments are working with community residents and gaining their feedback. Another initiative that we did was actually kind of turn how strategic planning is done around. And we spent 6 months building out what we call the minimum viable product. We wanted residents to actually have something in their hands to respond to, rather than take them through a year-long journey or more and not know how their feedback was going to actually be incorporated into the strategic plan. And so we're very thankful to have different frameworks that are being utilized, such as the Spectrum of Community Engagement to Ownership framework by Rosa Gonzalez. So we can actually measure how individuals are feeling as far as being part of the strategic planning process and implementation efforts, and if they see themselves as part of the fabric of the county government. And so our partners, really, we started first inward with the departments, so that they themselves are breaking down any silos, become multi-solving teams themselves, and then began work with our varying jurisdictions around us. So we become one county, as the vision indicates, and then moving out to our regional and state level partners. And so I'm excited. Our new county manager, Scott Andrews, who has started in Doña Ana just this month, is going to be facilitating a process for a state of the county address, where we'll be talking about the outcomes of the vital conditions framework, the family of measures, and presenting side by side with community residents. And so if you have some time in March, we again encourage you not just to come down for some hatch chili, but join us at this State of the County address and be a part of our efforts to change initiatives and work to have everyone thrive.
Thank you, Rosie. One of the things that was most impressive to me about this work from afar is how deeply the cast of characters across the county had embraced vital conditions. When it came time to hire a new county manager, the job talk in public on YouTube was, how are you, our prospective county manager, going to help us implement the agenda around vital conditions? So every job candidate had to stand up and say how they would take the baton next in the role of county manager. That is, when we're talking about data and signs of progress, that kind of commitment doesn't happen by accident. It happens through the work of colleagues like you and the team that you're working with. So thank you so much for that story. Liz, please help us understand what this work feels like with you and your colleagues in North Sound.
Bobby, thanks so much. And I just have appreciated getting to hear the two panelists so far. I have a couple of slides because I'd like to first just orient folks to where we are in Washington. So the first slide is just a map of Washington State. And we are the only state in the country that has these accountable communities of health covering the entire state. And that allows us to do some things that are cross-jurisdictional, thinking about both what happens locally, what happens regionally, what happens statewide. And so in the next slide, I wanted to just pull out what is North Sound, because in the state of Washington, we have these 9 ACHs, but in North Sound, we are 5 counties, all of them north of the Seattle, King County area. And that is the traditional homelands of 8 of the 29 tribes in Washington state. And it's been really significant because thinking about land and for us, the waterways, each of those 9 regions are really unique, but we have some common language and some common agreements about how we are approaching the work, doing cross-sector collaborations and investments. And that work began, even for North Sound, with an agreement with the Center for Medicare and Medicaid Innovation, CMMI. And then 3 years later led to Washington having the first of what is now 2 Medicaid waivers to invest in these regions and the approaches to do some connections between clinical and community-based innovation. But for North Sound, I just want to point out that we have got 2 counties that are separated from the mainland by a body of water, the Salish Sea, or what's probably known across the country as the Puget Sound. And they might be one county, but every island also has its own identity and wants to control like its own destiny. So when we think about the work that's occurring, we have to think locally, regionally, county jurisdictions, what are the cities doing? All of those pieces are at play. But the call out there that shows the 8 tribes is really important to us because of the fact that that's where we sit, is on those traditional homelands. And so back in 2018, we began what we refer to as a tribal and equity learning journey, wanting to have all of our partners across this region understand the legacy, the stewardship, the richness and generosity of this space that we think is incredibly special and beautiful, that so much of it is because of the leadership of the tribes, that it's what protects our waterways, protects the salmon runs, that they have standing with the federal government that we do not have. And so that relationship has just been really important. So tribal sovereignty is one of our grounding frameworks, and everything else that we do is intertwined with that, not additive, but intertwined. And so our frameworks include equity, targeted universalism and belonging from the work of the Othering and Belonging Institute, the vital conditions for health and well-being. And then in the last 2 years, we've added a set of principles around leading with love. Those things all comprise how we approach the work. And we have partners who are helping us in telling the story of not only what's the value, but what's the opportunity if we actually get a little bit better at understanding each other. And so on the next slide, I just wanted to lift up a couple of things that come from someone that I just so admire, Nicole Maher, who is the president of the Initai Foundation based here in Washington. And at a talk that Nicole gave, she pulled up these 3 stats. The one in people watching is a blur and or an immigrant. That 47% of the children who are in public school are people of color. That those who are between 0 and 5, the most diverse portion of Washington's population. And the quote that just stuck with me, that we need to imagine a state that's ready for them to lead and design the future that they want for themselves. And so we just kind of keep coming back to that. How do we actually give voice, create space that isn't about what my old self wants to design for the next generation, but how do we pull some of that forward so that we're actually hearing from and actually leading with what communities want to see in place? And so the last slide that I have, and then we'll turn the slides off, is really how did that change the work in North Sound for us as an organization? And so as you can imagine, we had a vision and a mission, and our mission or vision was something like improve the health of the 1.2 million people that live in our region. And after intertwining those different frameworks, at the end of 2020, our board actually scrapped the vision and the mission statements and replaced it with a purpose statement, because we were facing why do we need to exist? Is there a reason for us to be in this space? And what they came up with, it's to create a just and inclusive culture and the necessary conditions for all community members to thrive. And that was driven by those intertwined frameworks that we had in place. So we can remove the slides now. Thank you so much for pulling those up there. But our focus has been looking at our region, certainly region-wide, but if we take targeted universalism as an example, how do we assure that there's space for those who are furthest from access, furthest from justice, furthest from equity, that if we're actually going to do these things, that's where we start. We can do those things focused on populations that don't have the easiest way during, for example, whether it's COVID or we had a climate event that was a greater than 100-year flood that impacted 2 counties, that the people who were not being served were the folks that we were actually the most concerned about. And it has led us to, we use storytelling, videos, radio to try and reach different communities during the COVID crisis. We had to use those same strategies during the flooding. And what that has led to new partners coming to the table who never saw themselves being part of a regional collaborative in any way, going, oh my gosh, you mean you have space at this table for me? Would never have imagined that. And that has led us to initiatives around language access, working with young leaders, especially some young tribal leaders who are coming forward. And our work comes through this notion of the vital conditions. And the last piece I'll mention is that we have about 180 partner organizations across the region. And 3 years ago, we decided we were going to take a part of our budget and we were going to let partners decide how those dollars got used with other partners. And so we're now entering our 3rd year of a review committee comprised of partners who get submissions from other partners, and they get to distribute $3.5 million to try and decide where is that investment. And the investment is all focused around the vital conditions. And so it's been really exciting to watch them make decisions about what the investment should be in communities. And I'm just looking for dialogue. So thank you all so much.
Thank you, Liz, and each of you for sharing what is clearly passionate work that is not just a day job, right? This is work that brings our full hearts, our hands, our heads into it in new ways. And I was at a meeting recently where they opened with a quotation that all learning happens at the borders, and you can think about, like, we've got stories of borders here, literal national borders, tribal borders. We've got borders of where the investment has been and where it hasn't. We've got, we're living in an age of so much division and fragmentation, and so much of our medical industry divides people into disease and body part and population groups. And clinicians throughout history have sort of done personal histories, and then they look at vital signs at an individual level. What I'm struck by each of your stories is that you told a social history to understand the vital conditions in communities and what that means to do this work. So I'm wondering if we could just talk a little bit about what happens when we don't lose sight of the individuals, but we put them in context, when place matters, when love of people and place, and I use that love, that has shined through in not just your affect, but also your language here about bringing love to the foreground in this. So talk a little bit about what that feels like when you're interacting with people, when you're committed to the health and well-being of people, but it's got to run through place and through culture. I'm seeing lots of heads nod on that one. Sam, why don't we go back to you? What does that feel like in the room when you're with people who are starting to work in these ways?
I think traditionally, as we have tried to work to improve social and economic factors, our society is set up in such a way that there's silos, right? And we are pushed to think about our own organization's outcomes or the viewpoint that we are bringing to a particular issue. And that doesn't lead to that sense of collective. It leads to us sort of owning our piece and thinking about how we need to sort of survive as opposed to really connect with others. And so I think the most impactful thing is to see our partners, both within the healthcare system and in the community, be able to put the collective of a community ahead of their individual organization or outcomes of that organization. And within that allows people to really get to know one another. Liz, you had said, people understanding each other and having that empathy, that is only done by relationship building. And that enables us to keep coming back to the table. I think that is the harder part. It's easy to come to the table originally and say, yes, this is great, and we should all do something together. And then the going gets tough, and, finding the win-win that works for different organizations, or the policy that we have to change, or the barrier that's getting in the way for us moving forward. It really requires that we know each other at a level that we can talk through that and lead to a productive solution. And so I think that's been the most fascinating part to watch as we've been doing this work, is that it really creates spaces for people to just get to know one another better, get to know what our shared values are, because from that place we can move forward together. From that place we can think about what the solutions are or how we have to do differently. And it helps to break down those silos or make sure that we're not doing things within our individual sectors or organizations that are in the end easier for us, but detrimental for the community overall. So I think that would be my initial response to that.
Lovely.
Yeah, and Bobby, can I just be additive to that? And, so think about the number of ways that you're hearing about work happening in communities, and what are the measures that folks look for. And so through the first Medicaid waiver, that was like 2017 to maybe 2022, it was all focused on like behavioral health integration and addressing the opioid crisis and like all these very clinical things. And there were these questions that we would get from the state healthcare authority. So what's your sustainability? And what's the strategy that you're going to use? What do you think the impacts are going to be? And so as you can imagine, it's like, oh my God, we're going to reduce like the trend in emergency room usage. We're going to like decrease this. And we wrote, it's all about relationship building. I said our sustainability model, that people who do not know each other in the community are going to learn who each other are, how they can work together. And when you say, like, what are some of the surprising things? It would be being in a room with two organizations that literally had their offices on the same block and had never known that those two organizations existed in the same community, doing the same or kind of complementary kind of work, and then watching them come up with a project that they could work on together. That notion of how we actually start to, I'm really in this notion of like weaving a piece of fabric or something, how we see these things that we do as not being siloed and separate and distinct, but being intertwined. If we're working on behalf of the community, they want to see the network and the patterns and how can I connect this to this without having to start from scratch each time they knock on another door.
Yeah, it's a great point. And you know, there's been decades of research showing the value of collaboration, but it hasn't generated lots of investment in that collaborative infrastructure. So one of the things that was intentional about crafting the vital conditions framework is to describe what is produced when people are feeling connected, when they're really contributing. That's what belonging and civic muscle is. And Rosie, you talked about this work being about investment, about being able to bring resources to the things we value. And if we value relationships, if we value networks, if we value people feeling like each of them have a part of the thing, then how does belonging and civic muscle become not just visible, but also investable? I'm wondering if you could speak a little bit to that.
I think one of the pieces I'll say, I really appreciate Liz and what she shared about leading with love. That's actually one of the frameworks that the incoming county manager at Doña Ana County leads with, and what everyone is very excited about. And for it to become tangible, to be able to see that we're leading with love and there's collaboration, you have to change how you've done business for years as a government, as an entity. And I was reflecting of the responses of both of the panelists. We have to understand that community is angry, community is hurt, community has been exploited, whether it was on purpose, whether it was inadvertently. And there has to be an effort for us to realize and say, those before us have either succeeded or failed, and we're owning that. There is a sense of disillusionment, we're aware of it, and we are going to overextend ourselves and change our ways in working with community so that we do no more harm. And so when you first make this effort, that first piece is going to be a long-term effort to invest and overinvest and engage, bringing individuals, for example, into participatory budgeting. So that's the pieces that we're looking at as far as saying, how might we share our work and share at the table which infrastructure projects we need to invest in with community and change that process. What does that look like? How does that lead up to the strategic plan? Another is having presentations done, work done in collaboration with community and presenting that to White House stakeholders when we're writing national grants. The voices of community need to be upheld. They need to be heard. They need to be amplified. And that demonstrates a sense of respect that may be missing in certain communities. Once, from our perspective as a Mexican-American community, respect speaks volumes. Respect, loyalty, appreciation for hard work. And so we have to speak those languages to our community. They're demonstrating how we change, how we meet. For example, when we're at council, at commission, even the setup is intimidating. We've had individuals tell us, here I am in front of the dais looking at all of these people down on me, and I have 3 minutes to speak and I have to speak quickly. How can we change the dialogue of how we talk about policy? So much of what we've done historically has to shift. And then you'll see the tangible results of more people coming out to vote, more people getting engaged, more people speaking authentically and with respect when we disagree.
I'm sensing the scope of those learning journeys, which can feel immense to a lot of people, but it just starts with yourself, right? It starts with your organization, the close partners. So much of our healthcare enterprise, oddly, an industry set up for healing relationships has become detached from people and place, and so just forming those attachments is what I'm hearing each of you talk about, and then it can grow through those strong, tough, trusting working relationships. I'm also struck by another similarity in your stories, which is none of you are sort of narrowly devoted to a single framework. You're looking for what works in context. This is not about, sort of following a script of a particular theory and trying to prove it right or wrong. This is about taking action, looking at the reactions, and figuring out what works in a relentless commitment to, create that culture and those commitments that matter. And so maybe can you just talk to me about the discipline that it takes to be able to look for any idea that will work and try to put it into action as quickly as possible. I'm seeing that in your practices here, that this isn't so much about slogans, it's about what can we do through action and through action learning. Maybe we'll talk to this idea of multi-solving, right? Because that may be the expression of using multiple frameworks that ultimately say, can we advance many of our goals at once? So I heard all of you speak about multi-solving, but Sam, I think you mentioned it first. So what's backing that commitment to being multi-solving?
Think that we have limited resources, and we know that there's no one solution. I think our learning over time has been that adopting a singular model will have its pros and cons, and that by bringing multiple frameworks or models to the table, we're able to maybe build on the weaknesses of one or the other to really add up to something more. And then that helps to pivot. We can't just say anymore that it's just housing. The thing I always say is embrace the complexity around these issues. It's housing and education and sense of belonging, and we can't isolate them, right? So it's how are we all contributing to solutions that will hopefully address one area, but by doing so are going to have ripple effects on the other areas as well. And I think in doing that, then you need to have multiple frameworks that you're pulling from. You need to have multiple leaders. I think that also helps to validate and lift up the work as well. So one sort of easy first step you can take is think about who are those leaders across the country, like the Ripple Foundation and Bobby, the leadership that you're providing around bringing that voice to your local community. One of the first things we did was start a speaker series, and Bobby was our keynote for that to start, because it's not just about us believing this, but starting to spread that word more broadly in small ways and in lots of different ways. And that's where you see that language be adapted. And for the healthcare system, vital conditions might make more sense. But for someone who's in, the housing sector or community organizing, it might, resonate, a different framework might resonate for them. And so I think also having multiple languages that you can speak depending on the person and the perspective, it just creates that flexibility that does actually create a space where everyone can fit in, right? Because we have something that will speak to everyone. So I think the multi-solving piece is really acknowledging that isolating these things we haven't seen significant improvement in outcomes over time when we try to isolate. I think our next phase here is to really embrace the interconnection of them and then think about how do we address that from multiple ways and see if that leads to a more impactful and sustainable outcomes over time.
Rosie, Liz, thoughts on this question?
I have like two examples that come to mind. So one of our smaller counties, Skagit County, because of some of this work of being introduced to targeted universalism and belonging and the vital conditions, their county council and the mayors of 4 of their cities adopted the vital conditions for well-being. And it was really amazing. And so they built this table of kind of crossing county. And I mean, I say that going jurisdictionally, crossing counties and cities that's like a body of work unto itself. But they have this table that includes the mayors and then includes community partners. But they started with what I think is like a really hard topic, but it was one that's driving their budgets, which is the relationship between behavioral health and lack of adequate and affordable housing. Like they wanted to use the vital conditions framework to try and help them come up with some cross-jurisdictional solutions. And to Rosie's comment, and they said, we're going to use the vital conditions framework for our next budget cycle. just to like have them have that framework. And so it's been amazing to watch that in place. But like as a total aside, because of relationship, the person from their county elections office reached out and said, "Hey, North Sound ACH, I hear you do kind of like outside the box things. We'd like to have our 2024 election materials in both English and Spanish." And we said, now that's kind of related to belonging in civic muscle in the middle of the vital conditions framework. I think your county would support that because they're committed to that framework. And so we helped them through the last year. We thought it was going to cost money, but they actually did so much of the work themselves. And for the first time, a county that is nowhere near meeting the threshold that the Voting Rights Act requires is putting their materials in English and Spanish for this election year. And it has led to two other counties, like it hits their competitive nature, who also don't meet the required threshold, going, well, if Skagit can do it, oh my God, then we should do it too. And they're doing it because of this notion of belonging in civic muscle. How do we have the people in our community feel like they don't actually have to put in a request? We're doing it. We're doing it because we want them to have this better access to what I think is like the most critical component of civic muscle. It's the ability to vote. And trying to change from, hey, can I have an interpreter, to us putting on every meeting, we have interpreters available. You just need to tell us which language. You don't have to ask for an interpreter. We're going to presume that we will have that resource available. We just don't need to know like which language. Those small things change people's like just premise. Do I belong in that room or do I not? Am I invited into that space? Are you prepared for me to be in that space? And I'm just so excited to see what, like, does the voting pattern change in Skagit County at the end of this election cycle? But it's watching people do things because of the framework, not because federal law is requiring them to make some kind of a change. And I think that's incredibly impactful.
Rosie.
I just wanted to tell Liz that the Skagit County was actually one of our inspiration points and mentors. And one of the reasons why we had the audacity to think we could do this, because they expanded beyond their own jurisdictions, and we had different phone calls with them. So I just want to pass my gratitude to your colleagues and demonstrate how their inspiration is actually being realized here in the border area. I just have 4 things real quick, 60 seconds. Having the moxie to challenge it, you have to have that persona of maybe that level of ignorance. Is that actually the catalyst you need for innovation and for change? I didn't know any better. I didn't know that we couldn't do that. Well, now, we're not doing business as is. Have that mentality to challenge change. Also, we are looking into multi-solver cafes every quarter as part of a work session for our county commission. So we're bringing forward a very inspirational idea from community and testing it, piloting it, seeing what we can do. And then thirdly, for those that are in government, you are organically set up to have multi-solving discussions. You can bring together community development, transportation, public safety, and they can bring all of their challenges and identify one cross-cutting solution that can be financed through county budget if we were just to change the way we talk to each other.
Well, this conversation among us today has changed me already. I know you, and I know your work, and I visited the places that you're talking about here. And that is my wish for the people listening today, is that you turn toward each other in this moment when so many are turning away. Turn toward each other, turn inward to yourselves, and we will find a kind of humanity that has sort of yearning to be expressed in this work. And just the magnitude of change that is within reach is reason enough to say we're not limited by anything. We are capable of making great strides in this work. And I think all 3 of your stories illustrate that in indelible ways. So thank you, not only for today, but for the work that you do every day.
Thanks so much, Bobby.
Thank you.
Wow. Thank you all. Your work serves as a powerful example of how the vital conditions framework can be put into action, creating fair opportunities for good health and well-being across diverse communities. Next, we get to hear a change leader's perspective. Mayor Ramiro Garza from Edinburgh, Texas, was not able to join us today, but he recently sat down with Bobby to discuss community engagement. Mayor Garza is a passionate advocate for health equity in his community, spearheading initiatives to improve access to healthcare, nutrition, and active living, especially in underserved neighborhoods. And I'm proud that he is an active participant in the Move with the Mayor initiative. Mayor Garza and Bobby.
Thank you, Mayor Garza. It is a treasure to be with you to talk about something that I think a lot of people in the audience are really curious about, which is, we know that there's immense potential for people in communities all across the country to really create conditions that are built for everyone to thrive together. And you don't have to be an expert in a special framework or have special language to know what this looks like in practice. And, the reputation of what's going on in Edinburgh is traveling to, far and wide. So I'm wondering if you could give us a kind of a firsthand view on where the energy for improving well-being in Edinburgh is coming from. Who's showing up to do that work, and how are they charting a kind of a path forward?
Yeah, so thank you. And again, thank you for having me take part in this. So it's residents in our community that have come together as part of this initiative that we have, Edinburgh 2040. And it was a way to have City Hall connect closer to our residents. Edinburgh is a county seat here in South Texas, meaning that the county courthouse, for example, is in our city. We're home to the University of Texas Rogan Valley. We have two major hospital systems. And what this has done is brought those stakeholders together along with residents and participating and improving our city. And regarding health and well-being, we participated with our Move with the Mayor campaign, and that initiative really exemplified our commitment to promoting active lifestyle and building a more connected community. At that event, we had over 100 residents. Our actually superintendent joined us. We had a university leadership individual that joined us as well on this walk, and really simply to just get moving and promoting, community engagement. These walks encourage our residents to incorporate, this physical activity in their daily routines. And it's just really helped generate that awareness. The same spirit related to the health and well-being is also in place with several other key factors, or I should say focus areas in our community. This Edinburgh 2040 involves 8 different committees, from transportation to parks, economic development. We have a youth advisory council as well, a cultural arts initiative as well that brings events to our city every year. And so it's people throughout our community, residents that have an interest in these areas. The good news about these committees is that you're not having to get appointed by the city council. You simply could sign up. We have a website set up, our Edinburgh 2040. You just sign up which committee you're interested in, and you take part in that committee. For us, it's really helped us, have our residents engaged, and we're taking note of that. A lot of the recommendations the committees are coming up with, as an example, adding sidewalks in our city, has been adopted as part of our annual budget. And so we look forward to continuing this initiative. Our theme is Edinburgh is for everyone. If you have an interest to, for example, our Indian community, we're going to bring an Indian festival, let's have that, and let's have it here, and let's connect it together with another culture event where it's all about bringing our community together. And I think that's what our goal is, and we look forward to continuing to do that.
Such a lovely expression of the idea that we can create, kind of that sense of belonging. But once more people feel they belong, there's kind of so many opportunities for people in every walk of life to contribute, to build that civic muscle that makes us be able to do great things together. You mentioned that there's sort of a wide-ranging plan around this work and activities happening in many arenas. can you just give us a little window into the kind of investments that are going into this? Like, it does not just budget, but the kind of leadership energy that's going into this work, but also budget if there are real dollar signs behind it.
Yes, thank you. So these committees have been meeting. They help us really keep an eye out on the things that I think we should be focusing on. As city staff, I think we sometimes we're at City Hall and may not see beyond what a particular neighborhood, for example, a challenge may be, and so that's where these committees come into play. But as a result of their recommendations, in the last 2 years, we've approved over $10 million worth of improvements throughout our city. And these are improvements related to street improvements, for example, adding sidewalks as well, drainage, that's an important issue here in our community, lighting throughout our community, and then quality of life initiatives too. We've added parks space and expanding our trails as well, as it's just some example of what we're trying to do. And we're also helping our small businesses. There's a need for revitalization in our downtown. We call a FLIP program, which is a program where we match up to a certain amount to improve their facade, and that way they can put some fresh paint on their building and get customers come into their business. All these efforts came as a result of these, and we, again, going back to being the county seat and being home to the university, we have so many new people moving to the area. We're the 11th fastest growing city in the whole country based on the latest population estimates. And so we have to make sure that we bring everybody together. There's a lot of new people moving into the area, whether it's to the university, the hospital system, with the School of Medicine. It's important that we stay connected with the community and that we make improvements that are needed and that the citizens deserve. And that's what we hope to continue to do.
Yeah, it's a really fascinating story of how when you create space for people to sort of make their vision of a healthy, vibrant, connected community become real, and you bring the institutions to help realize that. Just how much can get done. This is a lot more than just preventing heart disease and stroke. That may be one of the consequences of this, but you're creating conditions for people to thrive, is what I'm hearing.
Correct.
It's totally impressive. I just want to revisit in our last moment here. You mentioned that a lot of this was coming from youth. Can you just describe the special role of youth in this work?
Absolutely. I think it's so important that we have our youth engaged civically. And in order to do that, we thought we would involve them early on. We have a youth advisory council. We invite and have them apply every year. We select 3 juniors from each of our high schools. So we typically have 15 to 20 students, participate, and we're taking them through a leadership program through our city government and learning about our government, learning and hearing from them. We always get results. I'm always surprised to hear what they ask. That I sometimes think that they're going to ask for things related to youth, but they want a lot of the same things adults want. They want entertainment. They want to be able to stay in our city. They want walkable streets, and so it's been a joy to have them participate and also having them provide that feedback to us.
Thank you for sharing your story. It's just a good example of how much we can do when we're not just focused on programs and projects and policies, but getting enough people to care about creating a community that is healthy, that is equitable, that really, has room for everybody in it. So thank you for all the work that you're doing and for sharing your story today.
Thank you.
Thank you, Dr. Milstein and Mayor Garza. It's really exciting to hear how Mayor Garza is engaging community members in Edinburgh 2040 and using Move with the Mayor, along with your other initiatives, is making an impact on the residents of Edinburgh. Mayor Garza, I'm delighted that although you couldn't join the panel live, you're here now for this Q&A session. So thank you very much for joining. We thought about doing a switch here, but your interview was just so good that we ran with that. We appreciate your joining us now. Rosie commented toward the end of the session that government is uniquely able to bring different stakeholders together. And then you followed, Your Honor, with a present day example of exactly that with Edinburgh 2040, where you're not just leading a whole of government approach to creating conditions for people to thrive. You're allowing for community input to inform and even drive decisions. I love that the decision about building more sidewalks came from community members. So one reason I'm so interested in this particular panel is that you, the three of you, represent the three sectors: public, for-profit, and nonprofit. One thing that stood out in each of your comments is that your organizations are leading and at the same time collaborating across silos. Um, I wonder if you could give one comment. What's one sort of breakthrough idea that you've learned through your work about how to bridge those silos successfully? How do you bring people into an inclusive process that strengthens the vital conditions, creates the conditions for people to thrive? Rosie, I quoted you, so let me put you on the spot to begin.
Sure. Well, I saw a comment earlier from one of the individuals, I think her name was Meg, about the similarities or some themes with collective impact. And that framework really does support the vital conditions. So a couple of things that have been very helpful. One, we do have to find a common agenda. It's mostly pain points across, departments. And when you bring that to the table and say, we can work together to address your agenda as well as everyone else's, there's more engagement. Another piece is, and Liz and I had talked about this earlier, just like demonstrating a culture of respect and gratitude for community residents, making sure that they're at the heart of everything and that they're going to be respected and heard. And then there's going to be action as a result of them being at a session with you. So those are two big pieces that we've seen a lot of success with, is just really the follow through, and not just how you're doing your plannings or your meetings, but the actual follow through.
Liz?
Yeah, and thank you, Rosie. The two pieces I would add are allowing time for relationships to be formed. Like, we're so used to jumping into the work that we forget that really the power in community is people getting to know each other and learning how to work together. And then I heard this, Mayor, in your comments as well. How do we actually demonstrate that we trust the community? How do we listen, actually take we're hearing to heart, and don't double question it or triple question it or turn around and go to an expert to verify what we're hearing from community? That, both creating those spaces, letting people get to know each other, and then just being able to demonstrate that we actually trust what we're hearing from community. We're willing to take action based on that. Those feel really important to us.
Your Honor?
Yeah, well, thank y'all so much. I really, appreciate the opportunity to be here with y'all. It is for me, I'm not sure if y'all know my background, but I like to say I come from the inside. I was a city staffer myself. I serve as city manager. So my perspective obviously is very different. When I was running, I obviously had a different mindset when I was trying to ask people and campaigning and voting for me. But one of the things that I noticed, because I was always in the inside and now running for office, is, there's just a big disconnect with City Hall and the residents, right? And so our whole idea of forming this, Edinburgh 2040 process, just to get citizens engaged. And I mean, time after time, I would hear, well, I'm seeing you now. I'll probably see you again when you're up for re-election, right? Because that's just how it is. And I'm a politician. I could say that about ourselves, right? And I obviously was really moved by that and made it a point to make sure that that was not going to be the case with me and our administration. And so that's part of this initiative. But I think, Rosie, you hit on something. It's important, is that, people want to be heard, but not just heard. They want action, right? And so the follow through is so, so important. And that's why these committees that we set up were not set up to meet on their own. We actually have a city staff person related to that issue, whether it's parks or infrastructure or economic development, that sit on those committees, and there's minutes taken by them. And then we've taken it a step further. We actually have integrated their recommendations into our budget process. So we've actually approved, as I mentioned, over $10 million of improvements that came directly from the 8 different committees that we have. And so I think, back to Rosie, I really appreciate your comments on that, because it's really kept our residents motivated. We have over 100 residents involved in this, and them seeing that wow, the idea that I had to connect this sidewalk to this, is actually included in the city budget. And and for us, sometimes when we're at City Hall, it's hard to see beyond City Hall, right? It just is. You get bogged down with so many things, that are happening. So they thank us, but I thank the residents. I said, look, you all know your neighborhoods better than anybody. So, your feedback you provide us is helping our staff see and add, things to our budget and our priorities that it would be hard for us to add if we weren't in your neighborhoods. And so, I think that's what I will add to this. It's keeping citizens engaged, but also making sure that they're seeing results come from that.
Thanks. This may show my lack of understanding of the vital conditions, and in particular, civic muscle. When I hear people talk about it, when I read about it, I think of it in terms of how do we help people, individuals in the community, feel like they're part of the community, and how does that create civic muscle? I feel like in the examples you've given, you've flipped that, and it's the involvement of community members that have added muscle to the community. Is that an accurate way to look at it, do you think?
Well, I believe so. Because look, the other way to look at this, right, is, well, you were elected, by the residents, so the decisions you make should reflect, right, the voice of the residents. But to me, when people go vote, they go vote, and then they're not involved, right? Because there's not a structure for them to be involved. And I think for us, this is a way for them to get involved. And so yes, I would agree with that. It's just a way for people to be involved. If you want to be involved, there's an opportunity to do so. And what I love most about our Edinburgh 2040 program is that you don't have to get appointed by our city council. A lot of people, when they ask them, serve on one of our boards, they just don't feel like submitting their information to the city. They're private citizens. And but this Edinburgh 2040, we have a website set up. You could just go in and log in and just sign up your information, and you're in. You don't have to be voted at a public meeting, right, to be appointed to a board. And so I think it's just made it easier for people to get involved.
Thanks, Your Honor. In her comments, by the way, if you have questions, if you're in the audience, you have questions, please use the Q&A function to get them to our panelists. We'd love to hear them. Sam Schock, in her comments, she talked about people putting the collective of community ahead of their individual interests. And that's certainly a current that we see running through a lot of discussion and debate in the political sphere and elsewhere in current day society. I wonder, in the context of the vital conditions, is that collective good and individual interest, is that a trade-off? Or does making a thriving community a shared create an environment that enables individual stakeholders to thrive and to reach their goals? Rosie, what do you see? What have you observed from your vantage point there, in the borderplex?
No, that's an excellent question and quite a hot button. I think because you're talking about shared power, and when you introduce the language shared power or shared influence, you're introducing an idea that you have more or I have more, and as a result of us coming together, one of us will have less. And I just listening to the Honorable Ramiro Garza, I know you're a Texan through and through because you said y'all. So I know that you're from the from the great state of Texas. And I think at least here on the border, some of the things I've seen is this zero-sum game. And that's a myth. And that's not a reality. And that we have to undo that type of culture that where one is elevated or one succeeds or is moved further away from a place of inequity. Someone else has a loss. So that there's a whole cultural shift there, John, that we first must address. And that is, to Liz's point, takes a longer time to establish relationships, trust, and then start to change the lens of which we look at things, where we all are thriving, if that makes sense.
Yeah, absolutely. Liz, I hear Rosie saying this isn't pie. If somebody gets a piece, that doesn't mean there's one less for you. Is that accurate? And do you find that, if so, does that resonate in the Pacific Northwest?
Yeah, and again, each of these comments is making me think about different things, but I think that if we think about our communities as being a whole, that if any segment of the community is doing better, the whole community is doing better. That when we start to think, oh, there's a trade-off, and know that in the public sphere, trade-offs are always a part of conversations. Like decisions sometimes involve that kind of negotiation, but in terms of belonging and civic muscle, it's how do we turn that conversation, pivot it, that if a group is going to do better, that means we are all doing better. It's really when we try to segment, I want to do something better for young people, and we think that that's separate, and I'm somehow saying I'm not going to do things better for seniors or working adults. It's really getting us to a point of seeing our whole community and how do we have different strategies to lift up everyone in our community.
Yeah.
That's when we get to that building that civic muscle. And, we're certainly at a moment in time where, our strongest civic muscle is the ability to vote. And that's like a moment in time that doesn't come every day. But what, you're hearing Rosie and the mayor talk about is it's not only at election time, it's every other time. How do we build those opportunities for people in our communities to exercise that civic muscle and get better at it? And the more we do it, the better our whole community will be. I'd like to think of us as not trying to segment the pie, but that every piece of that pie is making the pie richer and better and just like more nourishing to our community.
And can I just add to Liz's comment? I really appreciate it. If one part of our community is doing better, we all do better, as long as that community is not benefiting as a result of other communities.
Absolutely.
Yeah. Mayor Garza, I want to go back to a question that Warren Jones asked the previous panel, or a variation on his question. I think we're all familiar with the backlash against diversity, equity, and inclusion, or DEI, and that's loud and visible to all of us. And in some states, it's even taken the form of policies that discourage, and in some cases even prohibit employers and others from implementing DEI principles and strategies. So there's a frequent criticism we hear that the equity improving agenda, which I believe all or nearly all of us who are gathered here today support, is about imposing one faction's values on others. to the point that all of you just made, that it's an extension really of the criticism of public health that it's part of the nanny state. And this is why the National Forum has for several years been helping health equity advocates meet all Americans where they are, including white people and conservatives and those who are champions of individual liberty, and raise understanding that health equity benefits everyone. It seems to me that this is one of the ways the vital conditions framework is so valuable. Sam said it, I thought, really well when she said it aims to attract investment upstream to create conditions for people to thrive. So I think what I've heard from all of you is that vital conditions is about empowering people, not dictating to them. And it's about expanding opportunities for people to make healthy choices every day, not limiting their choices. So, Your Honor, you're an elected official in a politically conservative state. And I wonder, do you find that the vital conditions framework gives us language that can help more people see how equity benefits everyone and not just members of certain groups or classes?
Yeah, no, thank you for that question. I'm gonna again refer back to our initiative because that's what I know, right? Our Edinburgh 2040 committees. One of the things that happened is we did a survey first. We didn't just create, committees. We did a survey of our community. Our local university helped us with that. We had over 2,500 people fill out that survey. So our 8 committees were formed as a result of 8 different focused areas, right? And so, part of that is to ensure that whether it's planning for better parks or more accessible health services, we just wanted to ensure that every resident has a say in the policies that affect their well-being and make sure that it's community driven, right? Because at the end, we as a council have to make those decisions on what it is that we prioritize and fund. But it makes me feel really good in our budget when I actually have staff add in there, these came from a 2040 committee, like these line items, because those are coming directly from our residents. We have all our meetings are public meetings, but as y'all very well know, we don't have very many people active, right, in communities around the country. People, when you tell them, well, we had a public meeting on that, they said, we're busy. We didn't see the notice, or it's just the way it is. But people are going to these committee meetings because they feel their voice is being heard. And so I feel that because we're covering our bases through these different committees, having the needs of the communities based on the survey, I feel that's pretty equitable, and it's giving everybody an opportunity to have a say in what we do as a city, and more so than just going to vote, more so than just going to a public hearing, and expressing their opinion on something or other. And that was the whole point of us doing that. But going back to your question, I do feel based on what we're doing, we're allowing for the community at large, right, to be impacted in a way that before this, it's tough because we make our decisions at City Hall that we think is in the city's best interest. But how do we know that if we're not asking our residents? So I think that's a way for us to do that.
Great. Thank you. Rosie, if you can comment, and then Liz, you get the last word.
Just in regards to how vital conditions is furthering equity, what's that?
Yeah, do you find that it resonates with more of the public, more stakeholders than some of the other rubric that we've used in the past?
Absolutely, because it's almost as though some of our practitioners, and coming from a city or a county background, the departments of roads and engineering that I had highlighted earlier, they can see themselves in that reliable transportation being able to talk to sheriffs and law enforcement about public safety. And so when we've hosted different vital condition sessions, the department leaders get very excited. When you translate it into the residents, it feels less academic. It feels more relatable when you're talking about things. And some of them may, you know, for example, the natural thriving environment, that label felt a little different. They were thinking about like healthy environments. But they grab onto it and they feel that they can own it. And so if you're presenting something to a community resident that doesn't feel relatable, doesn't feel within their reach, they're not going to want to continue. It'll feel like it's being forced upon them. So the vital conditions framework, from what we've seen, has been exciting to hear their feedback on. We had a survey that had gone out with an initial baseline in certain areas of the colonias about feeling civically connected and having pride. And anywhere from 36 to 50% of our community responses from those thousands of surveys had said, yes, we do. We care about our county. How do we get those individuals to show up, though, at our town hall, at our county meetings, at town hall meetings, as the mayor had indicated? How do we translate that to next steps and actionable items? And we're hoping the vital conditions does that.
Thanks. And what I heard in your answer, actually, I was hearing echoes of an earlier question about how does all this connect to cardiovascular health? And so as Mayor Garza was talking earlier about better lighting in public spaces, you know, on the streets, and building sidewalks where people can safely walk. We know we can connect those dots. We know that those things that enable people to be more active every day do help control their blood pressure, do help reduce their overweight, do help to prevent diabetes, high cholesterol, other cardiovascular risk factors. So the dots do connect within this framework. Liz, in the Pacific Northwest, on the northern border, do the vital conditions resonate widely, or is it just with certain people?
Yeah, probably like two things. First, I'm going to just say the northern border is also seeing people coming from, you know, Argentina and Colombia. Like people are they're traversing our borders in really intricate ways. So I think our borders are, you know, potentially more porous than we think that they are. My oldest son speaks Chinese and Korean, and one day I was, you know, going on about the fact that I have no skill set in additional languages, and he said to me, "But Mom, you speak bureaucratese and health policy ease." And the thing about the vital conditions, that framework speaks to people in a layperson, non-policy wonk language. Like there's so many pieces about it that are not necessarily new, but if you're listening to community and what is important to them, those elements of the vital conditions framework speak to them in ways that the social determinants of health and other, you know, frameworks we've used in the past do not. And so they're seeing, oh, you're actually talking about my well-being, my ability to thrive, my ability to actually interact in a community that I understand. And to those 3,500 people that the mayor is responding to, the social connectedness that begins to occur when people actually are coming together and seeing each other, weighing in on things, those all improve our health. I mean, they're the interweaving ways that these frameworks come together are profound. And so before we adopted the vital conditions framework, we had about 50 partners that we were working with. And this week we hit 204 partner organizations that are coming together around the vital conditions framework. So it's capturing people's imagination of how the different aspects of our communities are connected. And I think people are excited to see the opportunity that sits in front of us.
Well, thank you for sharing your insights. Liz Baxter, Rosie Natividad, Mayor Ramiro Garza, thank you all so much for sharing your insights, your learnings, and your success stories with us. They're valuable.